Welcome back to Face the State. I'm Ariana Bennett. Thank you for being with us. Well, the Affordable Care Act has been offering health insurance through the online marketplace for 2 years now. But still, millions of Americans, including lots of Nevadans, are opting to pay the penalty rather than sign up. But the penalty is increasing this year. So now that the open enrollment period is upon us, what do you need to know to navigate the process? Janelle Davis from the Silver State Health Insurance Exchange is here now to talk with us about that. Janelle, thank you so much for coming on the show.
Thank you so much for having me. I'm happy to be here.
Okay, so now a few years into the marketplace being open, how are Nevadans doing in terms of the number of people who are signed up versus the ones who still need to?
So we're doing a lot better now. 2014 was not our finest hour. And, Nevada Health Link now is powered through healthcare.gov, and it is a much simpler process in comparison to our first and second year. This is an open enrollment number 3, and there's a lot, more available, and healthcare is much more accessible via online and in-person assistance.
So maybe people who the first open enrollment looked at the system and went, I'm completely overwhelmed, the penalty is not that high, I'm just not going to deal with it this year, might see a different circumstance this time around.
Absolutely, completely. The penalty is a lot higher. It's going to keep increasing each year in the next 20 years. So we do encourage people to shop the marketplace, and there are a lot of people who have the availability to get a subsidized plan, and they can do that by going onto NevadaHealthLink.com, answering a few short questions. It will take them to healthcare.gov, and they can do a pre-screener, and it's all based on their income, how many people are in their household, etc.
So what reasons do you hear from people for why they still haven't signed up now, this third open enrollment starting here?
Yeah, there's a lot of hard to reach populations. We really try to focus on the Hispanic population, tribes, self-employed, for example, hairdressers, people like this. We're trying to get them to sign up and enroll and realize, your subsidized plan could be cheaper than the penalty.
Yeah.
And it's important, when the Affordable Care Act came into enactment, there was the average family is there, a medical visit away from filing bankruptcy. And so we really encourage Nevadans to get on the marketplace, shop, and find a plan that is tailored to suit their needs.
That's the thing. I think we hear a lot of people, especially young people, say, well, I'm healthy, I never get sick, I don't go to the doctor very often, and that may be the case, but with medical bills being so high right now, even something as simple as needing an MRI, we're talking thousands of dollars out of pocket, and that's just to get a diagnosis. Without health insurance, that can be a real struggle, and you never really know what can happen.
Exactly.
And that's not even considering the penalty this year, which is significant. We should probably talk about that a little bit. $700 per person minimum, or 2.5% of your household income, whichever is higher. So a huge difference from what it was the first year, which was around $95 per person. People thought, oh, that's nothing.
Right.
$95 for a year, that's nothing. But $700 this time around. So definitely not something.
And it could also be, over $2,000 for each family. So that's something to also take into consideration. And outreach and education is just really important at this point to try and make people realize, this is affordable and it is accessible. Please call us and get in-person assistance. We're there to help.
Yeah, let's talk about that a little bit.
Sure.
Are there a lot of people taking you guys up on the assistance? Because it is free, it's one-on-one.
So there are a few different ways you can actually enroll. One is to go to our website, NevadaHealthLink.com. There you can actually find a broker or agent in your community by using our in-person assistance tool. And the broker and agent community's actually been working really well with us. That relationship's kind of been healed over the last couple of years. So they're working with us to do enrollment events. And so we really encourage people to do in-person assistance because insurance is confusing and a lot of people don't know what is available to them. We also have navigators that are available. Our call center, there's no wait time, no hold time. They're going to talk to someone right away. And you can also visit the carrier-specific website, so you can go directly to the carrier to find a plan and talk to a broker agent that way. So lots of different options are available.
Yeah, there's a pretty wide range of costs too, in terms of having a lower premium to the higher end, and in many cases people can find something that fits within their budget alongside subsidies, right?
Yes, that is correct. So it's all based, like I said, on income and how many people are in the household. And what will happen is if they're eligible for a qualified health plan, a QHP, then we discover that through our pre-screener. And if they're Medicaid eligible, then we also direct them, in that way to get Medicaid assistance.
So there are a lot of different avenues that people can take who are maybe thinking, well, I'm living paycheck to paycheck. I can't afford another cost. In fact, the state might be able to subsidize that insurance so the cost isn't as high as you expect it to be.
Exactly. Yeah, and so we're just trying to, educate and outreach. We're doing a lot of enrollment events and outreach events, even, leading up to open enrollment, where people, we have booths and tables and navigators available to help with information, talk about subsidies, talk about deductibles, and just, get people out there to realize, this is something that is affordable, and, we're here to help you.
Do you guys have a goal for getting, a certain number of people enrolled this time around?
We don't always like to talk numbers, but, the first year there was about 30,000 people who went through the eligibility enrollment process. That is, logged on to Nevada Health Link, found a plan, basically shopped the marketplace like something like Amazon, and hit checkout. Only a certain amount paid, of course, and so that was around 63,000. That's currently where we are right now. About 73,000 went through the enrollment process. We absolutely hope that there's going to be an increase there, but it's just hard to determine at this time. But we really encourage people to shop the marketplace due to plan changing and carrier changes.
What are the most common misconceptions that you encounter when speaking with people about this?
I would say that they think they can't afford it. They think they don't need it. They think that, I'll just pay the fee when it gets here. But what a lot of people don't realize is, young people are getting into car accidents, and it is affordable, and it can happen. Car accidents happen all the time. Doctor visits happen all the time. A lot of families need this and need our assistance, and they don't have that available through their insurer.
Absolutely.
Or through their employer, I should say.
Yeah, that absolutely makes sense. Okay, so as someone is approaching this process, what do they need to have with them? Is there anything in particular they need to collect?
Yes, so they need to have their Social Security, their name, phone number, all information. The pre-screener really just asks your income, and if you're a Nevada resident, if you are a U.S. citizen, and any of those documents. And this information is also located on our website. It's kind of like a checklist of what to bring to our enrollment events.
Okay, so really just navigate through the website is what they should be doing.
That's the most helpful, and also to call our call center. We're using social media channels this time around, and our ad campaign just kicked off, so you'll be seeing us a lot in the news with Nevada Health Link.
Is it largely young people who haven't quite gotten on board with this, or is it a range of ages?
That's a good question. I think it's young millennials is obviously one of our big targeted audience, but I would say anyone from 26 to 55, or anybody who qualifies for a qualified health plan and is not eligible for Medicaid.
Okay. What other tips do you have? Anything that people need to know?
So we have a few enrollment events coming up, and so that will be in-person assistance. And I would encourage people to shop the marketplace. Our carriers have changed. So, for example, if you were on an Assurant plan, that nationwide has dropped off the exchange marketplace, and so we encourage people to look at the new carriers and options, call a broker or agent near you, and get in-person assistance, attend these events, and just call us.
Yeah. So it's not just people who don't have insurance, it's also people who maybe need to re-enroll.
Yes, exactly. Very good point. The re-enrollment process is a lot simpler this year, just with healthcare.gov as our eligibility platform. But however, like I said, if they were on those plans or those carriers, they have changed. So we just encourage them to call somebody and or shop the marketplace online to see if they can find something else that will work for them.
Or for that matter, if they've had life changes, you know, had a kid,
Absolutely.
or, you know, other issues, things like that,
Right.
they might need to
Report
get a plan.
income and life changes, exactly.
Right, get a different plan that fits them a little bit better.
Another tip too is, so open enrollment begins November 1st, 2015. It goes all the way through January 31st, 2016. So we encourage people to attend our enrollment events around December 15th if they want that coverage to begin in January.
Right. That's right. So if you don't have insurance or you want your insurance to continue, really the deadline is December 15th.
Yeah, exactly. It goes through the 31st, but yeah, if you'd like to have that January start, that's what we recommend.
And real quick, for someone who maybe has insurance that will last them a certain amount of time through the year and then say they're leaving that job, is it still possible to enroll through the marketplace even when it's not an open enrollment period?
So sometimes it all depends on the federal facilitated marketplace. If they decide to extend, you know, a special enrollment period, you know, we will be the first to know. So then they can still do that. But again, yes and no. They can go and report, you know, a job change, and that might be an income change.
Absolutely. Okay. Well, we have just under a minute left. Is there any other message you have for people? Anything they need to know?
I think that's it. I can give the phone number if you'd like. I can
give
that.
the phone number.
So please call us or visit NevadaHealthLink.com, 855-768-5465. We're here. We're available. We're excited for an upcoming open enrollment, and we're, you know, hoping Nevadans enroll with us, and it is the law now. So
absolutely.
Yeah.
All right, Janelle, thank you so much for your time.
Thank you so much. Thanks for
having me. That is it for this episode of Face the State. But for more information or to see past episodes, just head to KTVN.com. Thank you so much for being with us. We'll see you next week.